What happens after you quit smoking? The timeline of quitting smoking, the benefits are almost instantaneous. Just my usual reminder. This video is for educational purposes only, so do speak to your doctor if you have any medical concerns. As soon as a person stops smoking, their body starts to recover in the following ways. After 1 hour, in just 20 minutes after the last cigarette smoke, the heart rate drops and returns to normal. Blood pressure begins to drop, and circulation may begin to improve. After 12 hours, cigarettes contain a lot of known toxins, including carbon monoxide, a toxic compound present in cigarette smoke. It can be harmful or fatal in high doses and prevents oxygen from getting into the lungs and blood. When inhaled in high doses over a short time, suffocation can occur from lack of oxygen. After just 12 hours without cigarettes, the body clears itself of excess carbon monoxide from cigarettes. Carbon monoxide levels return to normal, increasing the body's oxygen levels. After 1 day, just 1 day after quitting smoking, the risk of heart attack begins to decrease. Smoking increases the risk of developing coronary heart disease by lowering good cholesterol, which makes heart-healthy exercise harder to do. Smoking also increases blood pressure and the risk of blood clots and stroke. Within just 1 day of quitting smoking, a smoker's blood pressure starts to drop, lowering the risk of heart disease from smoking-induced high blood pressure. In this short time, a person's oxygenation levels will improve considerably, making physical activity and exercise easier to do, and promoting heart-healthy habits. After 2 days, smoking affects the nerve endings responsible for the senses of smell and taste. In just 2 days after quitting smoking, a person may notice an increased sense of smell and stronger taste as these nerves heal. After 3 days, by 3 days after quitting smoking, the nicotine levels in a person's body are depleted. About 3 days after quitting, most people will experience low mood and irritability, severe headaches, and cravings as the body readjusts. After 1 month, in just 1 month, a person's lung function begins to improve. As the lungs heal and lung capacity improves, former smokers may notice less coughing and shortness of breath. Athletic endurance increases and ex-smokers may notice a renewed capacity for cardiovascular activities such as running and jumping. After the 1st of March months, over the next few months after quitting, circulation continues to improve. After 9 months after quitting, the lungs have healed significantly. The delicate, hair-like structures inside the lungs, known as cilia, have recovered from the damage caused by cigarette smoke. These structures help push mucus out of the lungs and fight infection. During this period, many ex-smokers notice a decrease in the frequency of lung infections, as the healed cilia can do their job more easily. After 1 year after quitting smoking, the risk of coronary heart disease drops by half. This risk will continue to decrease after 1 year. After 5 years, cigarettes contain many known toxins that cause the narrowing of arteries and blood vessels. The same toxins also increase the likelihood of developing blood clots. After 5 years without smoking, the body has healed enough for the arteries and blood vessels to start widening again. This widening of the blood vessels means that blood is less likely to clot, lowering the risk of stroke. The risk of stroke will continue to reduce over the next 10 years as the body heals more and more. After 10 years, a person's chances of developing lung cancer and dying from it are reduced by about half compared to someone who continues to smoke. The likelihood of developing mouth, throat, or pancreatic cancer is significantly reduced. After 15 years of quitting smoking, the likelihood of developing coronary heart disease is equivalent to that of a non-smoker. Similarly, the risk of developing pancreatic cancer was reduced to the same level as a non-smoker. After 20 years, after age 20, the risk of death from smoking-related causes, including both lung disease and cancer, drops to the level of a person who has never smoked in their lifetime. Also, the risk of developing pancreatic cancer is reduced to that of a person who never smoked. Benefits of quitting smoking. Smoking is a harmful habit that can lead to severe health complications and even death. When a person quits smoking, the body will begin to heal naturally and regain over the years the vitality of a non-smoker. Blood circulation can improve. Carbon monoxide levels in the blood may decrease and eventually be eliminated. Oxygen levels can return to normal and the risk of a heart attack can be reduced. Breathing may become easier and more vigorous. Some effects, such as lower blood pressure, are seen almost immediately. Other effects, such as the risks of developing lung cancer, heart disease, and lung disease, are reduced over several years to the level of a non-smoker. However, every year without cigarettes decreases the risks of serious diseases and improves overall health, making quitting smoking a great choice for anyone with the habit. Thank you so much for watching this video. As always, I wish you great health, wealth, and happiness.